Okay, guys, we're going to look at chapter 7. So chapter 6 has already been posted, so we can go ahead and move forward to chapter 7. So you guys that haven't seen chapter 6 need to watch that online. Again, it's up to you how you control your learning environment. Whether you like lectures, watch it, listen, take notes. If you don't, if you would rather read and take notes, whatever. It's up to you. It's your learning styles, not mine. Okay, so I just gave you the PowerPoints on chapter 7, and maybe you have caught on now that there are notes in those, trying to key you into what you need to be looking at and what you need to be studying. So with your axal skeleton here, you're going to have to know everything of both the axle and the appendicular skeleton. One thing you want to know is how many bones are in the adult human body. Because does a 3-month-old have more bones than you, or are they the same? Yeah, they actually have more. And it's not that they have, the problem is their skull is not fused together just yet. So when you count those bones all separately. Unlike ours, we're all fused together. So now it's just one. So yeah, they actually do have some more than we do, just because they're not fused just yet. When you think of axal skeleton, think of like spinning on an axis, the main thing. So that would be skull, vertebrae, that's the main trunk. So rib cage, pelvis, that's all axal skeleton. So what main supports? So if you think of appendicular, your appendages. That's your appendicular, so your arms and your legs. That's simple. No big deal. So you got to know all these. We'll do a couple of games and things trying to get you to where you'll memorize these bones. If you do memorize your bones, it'll definitely help you for when we move on to the muscles and when you move on to neuro. These bones will help you out. Because talking about neuro, the skull here, when you learn the frontal bone, you'll also learn behind that is your frontal lobe. When you learn your parietal bone, you'll learn behind that is underneath those are your parietal lobes. Occipital bone, underneath it would be your occipital lobe. So these will actually help you out. So learn them now because it will come back and get you. Looking at these bones, you can see they're all colored. This is all the skull. We also have facial bones, so we're not going to look at those just yet. Let's just look at the skull. One thing I wanted to point out was your green here, the temporal bone. All of this is the temporal bone, but even half of this zygomatic process, which is just your cheeks, the zygomatic bone is all of that. Process is where you feel stick out. Processes are boning points. So this one would be a zygomatic process. Would be the bone, your point sticking out. Would be your cheekbones, yeah. And so the zygomatic bone is all of that. But what I want to point out is the zygomatic arch. This tiny section here is part of the temporal bone. So the zygomatic arch is included in the temporal bone. Yeah, I know, it's kind of weird. They should have said it was all on its own, but they didn't. So I needed to point that out so you know for sure. Yeah, we won't mess with that. So we'll come back. We'll learn all those. Sutures, you're going to have to know your sutures as well. This is where we were talking about they could have more bones than us. Our skull is fused together where theirs is not. So if you were talking about fontanelles, in chapter 6 I talked about soft spots or fontanelles. Here is where you would see one. So you'd have an opening right there on a baby. Anyone less than 2 years old. And then you'd have one back here, if my board worked correctly. You would have a fontanelle back there. An opening. They're kind of star-shaped. These fontanelles, like I said, by the age of 2, they'll fuse together and close, and then you'll have one big skull. So that explains why, again, those little ones under 2 can run really high temps, whereas you cannot. Because if you had 107 temp, what would happen? Not necessarily die just yet. May have some brain injury, but you'd go into a febrile seizure, and then yes, you could have brain injuries and die and succumb to them. Because again, when things heat up, what do? They expand, they get bigger. So in this here, in our adult, not 2 and under, an adult, this is a closed box. And there are 3 things in this closed box. When we get into the nervous system, this is going to become important again. Inside this closed box, you have brain tissue, so you have brain, you have blood, and then you have cerebral spinal fluid. Those 3 things, when one increases, those others have got to go down. So if brain tissue swells and increases, that means cerebral spinal fluid and blood will go down, trying to create an equilibrium. And the box doesn't do anything. We can't move the box. Now, if it goes past the point that we cannot fix it, we cannot create any type of equilibrium, then the foramen magnum, where our spinal cord go through to the brain, that's where your brain will herniate. So if you have some type of brain injury and those things do not level out and we cannot get you into surgery and fix anything, then your brain will herniate through there, through your spinal cord, push it on the spinal cord, and that will kill you. So no, everything at the base of the brain, the spinal cord, are your vital centers, so heart rate, respiration, you will die. That's why they can go in there and create what are called burr holes. They can drill into the skull, relieve pressure. They can put drains in there and drain out cerebral spinal fluid, remove blood if they need to. They'll do different things to try to relieve that pressure. What I was getting at, though, you got to know sutures. You got to know your different sutures there. You got 3 of them that you've got to know. So that's just going to take memorizing those. Brain injuries, like I said, with the swelling, what happens with the babies? They're not fused, so they can expand. Another thing I wanted to point out, again, we'll memorize all these bones. There's actually 14 of these facial bones. There's a couple of things I wanted to point out here. One, this maxilla, it's kind of what you call the foundation of the face. It's kind of what everything else attaches to when you're doing facial bones. Even this mandible attaches to the maxilla. So this front part, and it's actually made of 2 bones. They fuse together. But these 2 bones, this maxilla here, is your foundation. There is a floor of that maxilla, and if you get any types of injury, say that nose was broken, and if you break the floor of that nasal bone, then you could actually puncture up into the lung and have dripping of cerebral spinal fluid. So a lot of boxers that get broken noses, they'll test the fluid coming out of their nose. A patient one time, because the nasal cavity, the floor of it is sitting right, the brain is right there above it. So I had a patient that had a car wreck years ago, and ever since the car wreck, he had just a runny nose. No big deal, clear, runny nose constantly. And it seemed to get progressively worse. He finally went to the doctor. Figured out it was cerebral spinal fluid that he was constantly leaking. And so they went in there and surgically repaired that hole that he had. It was from a fracture. Had a little crack and cerebral spinal fluid was dripping. So car wrecks, anytime you get victims from a car wreck and they come into the hospital or the ER, they will test runny noses and they'll test runny ears. And they're looking for cerebral spinal fluid. How do you think they test it? What is the brain? Yeah, they swab it. What does the brain feed off of? What does the brain eat? One thing mainly. It will eat amino acids. That's from proteins if it has to. But there's one nutrient that it eats only. Will cross the blood-brain barrier. We'll talk about this in neuro. So you have carbohydrates, you have proteins, and you have lipids. So carbohydrates are basically what? What do they break down into? Sugar. Your proteins break down into amino acids, and your your fats break down into lipids. So your brain, it feeds off primarily glucose. So when you take a blood sugar, you're testing glucose levels. When you're swabbing a runny nose that you think is just a runny nose, if it has sugar in it, it's not a runny nose. It's cerebral spinal fluid. Or if you have ears that are dripping, it's cerebral spinal fluid if it's got something in it. So cerebral spinal fluid is clear. That's what they're looking for if they have a brain injury.
It's clear?
It's clear.
But is it like the same like consistency?
Yeah.
Or
Looks like
slime?
watery kind of. Yeah. And he did. He just said I would constantly have just this nasal drip. And I was like, that's crazy.
Does it hurt?
Because that's a big deal, yes. Your cerebral spinal fluid runs all around the brain, and then you've got 4 ventricles, which are holes in the brain that it feels, and then it runs all along the sides of the spinal cord, all the way down, and even up in the center of the spinal cord. And so it has macrophages in it, so it has white blood cells to help clean things if there's any infection or anything. It's got nutrients, carries oxygen, it's vital.
Wouldn't it have like a scent to it? Like this is sweet?
No, it won't. And another thing, the brain kind of sits up with the cerebral spinal fluid. So if you have leakage of it, it'll sag down. And again, we get into big trouble of it sagging down and putting pressure on that spinal cord here. Because it'll sag through this hole. It would cause pain. Yeah. Because then when the brain starts to sag, it pulls on those meninges, which these are membranes around the brain, and that'll cause pain. Okay. I was getting off somewhere else, but I forgot. Okay. Let's look at sinuses. You kind of wonder what sinuses have to do with the spinal or the skeletal system, but sinuses are just actual holes, kind of like caverns within the bones. And they're important. What do you think they are filled with? Sinuses. What do you think they're filled with? They're just holes.
Air.
And then, yeah, they are. They're filled with air. They're lined with a mucous membrane, so we can produce mucus in them if we need to. So sometimes they get impacted, and they get infected, and we have sinus infections, yuck. But what they do is when we take in the air, so through our nose, the air kind of circulates and moves through those holes or caverns, and it warms and humidifies the air, so that helps. But it also gives us what's called sound resonance. So how we sound, our voice quality, or singing quality if you can sing. But if you've ever had a cold and people, oh, you're singing easily, it's because those are filled. They're not with infected, got pus or something in them. Oh, and another reason for them is they'll make your skull lighter, not as heavy. Because, you know, if this was just solid bone, it'd be really heavy. So think about like birds. You know, their bones are kind of hollow, makes them light to where they can fly. So this thing would be really heavy carrying on this little, you know, vertebrae if we didn't have some holes in it. So there's a couple of functions for our sinuses, but we mainly think of voice quality. Which bones or bones form the foundation of the face? So what bone was that? It's made up of 2, but we only gave it one name. Gives the foundation of the face. Maxilla. Sure is. You do need to know the different segments of the vertebrae. So a lot of you are aware of, especially if you're involved in sports or anything. So the cervical vertebrae, which there are 7 of them, if you think of like a cervical collar. I know you've all heard about a cervical collar. Injuries, football injuries, car wrecks, and they put that big plastic and they can't move. That's a cervical collar because it goes around the cervical vertebrae to hold it stationary. Then you have 12 thoracic lumbar. So if you think of the thoracic cage, obviously that would be the thoracic lumbar or thoracic vertebrae, not lumbar. So C1 through C7. So cervical 1 through 7, and then counting would start over T1 through T12. So thoracic 1 through thoracic 12. All this becomes important because if you have say a T4 injury, that will affect probably your arms. So you may or may not have use of your arms down. Ooh, if you have a C4, you're in big trouble. Yeah, that's a big deal. Yeah. So if you think about someone that has, most people, a C1 or C2, if they have a complete, say, injury there, they're not going to make it. It's way too high. Let's see. So if you have, say, a C4, they're going to be a quadriplegic. They're not going to be able to use their arms or their legs. If it's a complete, that means the spine is gone. It's severed in two. Because you can have a partial and it not be. You can still have like sensation, but maybe not movement. Partials are those people that you'll see in like the wheelchair. They can't use their legs, but if they'll take their leg out, it'll move involuntarily on its own. That's a partial. A complete is it won't move at all. They can't feel you touching, but some of you'll find in the nursing home, you'll read in their chart that they're paraplegic, and you go to move their legs, and they're like, oh, and you're like, I thought they were paraplegic. And they can kind of, like their toe will twitch or something. Like, they can move. Well, it's a partial. That means it's not completely severed, or they had so much swelling in that area it put pressure on that spinal cord and killed some of it. Okay. So L1 through L5, your lumbar vertebrae, that's, if you think about the lumbar chairs, where that fits even. Sacral vertebrae, way down, those are all fused together. And then you got your coccyx, so the remnants of your little tail that you used to have. Or your tailbone is what you think of. If you ever broke it, then you know how important that thing is. It's very painful if you've ever broke it. If anyone's ever kicked you in your butt and you broke it. Or skating, that's a big one. Skating and you fall on your rear. Ooh, you can break that little bone, and that thing is painful. Doesn't really do anything, but it's painful. What were you saying? Yeah. Yeah, there are people. Vestigial, something that we used to have, but we don't need anymore, and we don't have, but some people will still have vestigial traits. Yeah, a little tail back there.
I thought it was fake.
If you know just how to do it, you can land without hurting it at all.
Oh yeah, if you figure out how to
You know how
turn
to do
it.
it right.
So the sacral, those are 4 to 5 vertebrae that are actually fused together. So that's if you look at this guy, so this one here, they're all fused together. And then there's his little tail, his coccyx. So that can be anywhere from 3, 4, or 5 little bitty tiny vertebrae fused together. Where was I getting at? Okay. There are 2 terms that you want to know. One is kyphosis, and that is like the hunchback of Notre Dame is what you think of. Someone that's hunched back, or the really, really old. You've seen the little old people with osteoporosis and they get hunched. That's kyphosis. I don't know how else to do a Dean Bond kind of version of how to help you remember the med term for that. Maybe you can come up with something, but maybe crippled old person. Lordosis is another one. Lordosis you'll see with your pregnant people, where the abdomen gets so large and distended, and to distribute the weight, to change a little bit, they kind of get that swayed back, where the belly's out and the back's way curved in. That can be an issue. So it's kyphosis.
Go back after that?
Yeah. Yeah. So kyphosis and lordosis. What's scoliosis then? So, yeah. So the kyphosis and the lordosis are going this way, the vertebrae, whereas scoliosis is going this way. So it'll curve, and there's varying degrees of it. You've noticed Miss Stratton, how Miss Stratton kind of walks stiffly? She's got rods all the way down her vertebrae because she had severe scoliosis when she was young. So she's had a couple of surgeries to correct, and if you notice, her shoulders are off and her hips are off, and it's because of scoliosis. So that's kind of cool. She'll talk to you about it. kind of cool. Maybe not cool for her, but and it does cause pain and things like that. Let me stop my video a second.